Welcome to the Lyster Health Talks podcast. Today we are bringing you the ultimate masterclass in how aviation medicine ties into Army Aviation. In our recent 8-part mini-series on aviation medicine, we covered everything from flight physicals and the role of the flight surgeon of the day to navigating mental health, protecting your hearing, and busting the biggest myths about what gets you grounded. We have combined all 8 of those episodes into one complete, seamless collection. So let's get started. Here is the complete Lyster Health Talks Aviation Medicine mini-series.
Welcome to the Aviation Medicine mini-series from Lyster Health Talks. I'm Lieutenant Colonel Leah Steder, the Director and Commander of Lyster Army Health Clinic and the host of the Lyster Health Talks podcast. In this Aviation Medicine mini-series, we'll sit down with experts who help keep Army aviation flying. Together, we're going to discuss topics that impact readiness, performance, and the long-term health of our aviation force.
Episode 1.
When to start your flight physical, and the key takeaway is don't wait. Today, I'm lucky enough to be joined by Liz Johnson-Bailey.
Hi, I'm Liz Johnson-Bailey. I'm an aerospace medicine physician assistant. I have been at Lyster for 16 years. I am now at the Aeromedical Activity and review flight physicals. I love aviation medicine, not so much the flying part because I'm not a great pilot, but I'm a much better medical provider.
Ms. Johnson-Bailey, what is the biggest mistake people make when preparing for a flight physical?
Okay, so first of all, let's start with brand new applicants. If you are someone who says wants to go to flight school or you want to put in an application, I have a completely non-aviation related job. You want to start a minimum of 6 months prior to your anticipated acceptance date. I recommend a year. It is going to be a minimum of 3 months before a physical is reviewed from the time it's submitted and put through the administrative processes. It may take 2 months for you to get your workup complete. So start at least 6 months prior. If you are a rated aviator or you are already in the aviation pipeline, you have wings, you're a crew member, you're an ATC, you have what's called a birth month window. That birth month window starts 2 months prior to your birthday. And surprise, your birthday's the same day every year of your life. It has never changed. So if your birthday is in August, your birth month window starts in June, 2 months prior to your birthday. Your physical expires on the last day of your birth month for people who are in the aviation pipeline already. So you start your physical when that birth month window starts. That helps mitigate any timeline problems in getting all of the things accomplished you need for that physical. It's also good for health prevention because as we get older, there's other health screenings that have to be done. You have women's exams, you have colonoscopies, things like that. If you never forget when your birth month is and you know, oh, hey, I'm turning this age and I need this screening, and then you know, oh, okay, at age 45, sometime before my birth month, I need to get that screening done. And then 3 years later, like, oh, when did I get that done? It was around my birth month. Happy birthday to you. Get your screenings and your physical done.
Can you tell us how our ROTC cadets might seek out flight physicals?
So ROTC cadets generally get flight physicals during their summer camps associated with their schools. We will once in a while see an ROTC cadet that actually is a dependent of someone at Fort Rucker. They can call the appointment line, but they are encouraged to do it with their school during their summer camp. Now, if they have a disqualifying condition, they should be given a paper that explains what the workup they need should they come back home to Fort Rucker, and they're told, hey, this is the workup you need, and then their primary care provider can work from there.
That's great. And I know some cadets might change their mind and decide they want to become an aviator after advanced camp. I know some places will do flight physicals for them, but I think it's important for them to know that they have to have a valid flight physical approved in the system before October.
Yes. That deadline is a serious deadline too. And please do not try to do that in September. Get it as soon as you realize that your goals have changed. Even if you don't feel like, hey, aviation isn't my top choice, just do your physical. Have it ready. Be prepared, like Boy Scouts.
In general, it's a little different here at Fort Rucker possibly than other places, but in general, what would you say is a realistic timeline for folks completing their flight physical?
From the time you book your appointment to the time you get it completed, I would say an average of about 4 to 6 weeks. Now, and that's just to get the main components of the physical completed. Now, if you have waivers, there may be outside resources that we depend on that can make that take a little bit longer. But the first step would be to call the 1-800-261-7193 to book that appointment. And you should do that the minute your birth month window opens.
Yes, and I think it's important to know because some of our listeners might be, as you mentioned, if you're new applicants that are going to be street to seat from high school right into flight school and or ROTC. And in your experience, have those taken a bit longer?
So new applicants can take longer because they are not in our pipeline and they're not a priority to get done by a certain time. And so, for example, if we know, hey, maybe you just PCS'd here and you didn't get your physical done. Say your birth month's August, you didn't get your physical done in July at your previous duty station. Now we're time pressed to get it done by the end of August. So you're going to have priority over someone who did not. Whereas a brand new applicant, there is not a priority on our end to get you done by an application deadline. That priority would be placed on you.
Is there any records or paperwork that new applicants should gather to bring into their appointment?
So if you have a MEPS waiver or an accession waiver, a DOD-MERB waiver, those are sometimes documents we do not have in our medical record that you may want to bring with you to that appointment. Most medical records we have access to. Now, there may be something that you fill out when you're filling out your report of medical history that you will be asked during your interview portion that we ask you to bring in additional documents to. But about 80% of medical records are in your electronic health record and we have access to.
Perfect. You've brought up several times about approving flight physicals. I think it's important for our listeners to understand, especially those that it's their first time, that the flight surgeon is not the final approver. Is that correct?
That is correct. So there is a process. So you will start by booking an appointment. Your first part of your appointment is booked with a physical exams technician. They will take your history. You will fill out your paperwork. You will then process through a screening for vision. You can do a screening for hearing. Depending on the type of physical, if it's a short physical or a long physical, you may have lab work to do. You may have lab work that is your readiness lab work, like maybe your HIV, or you may have physical lab work. Then you will, if you do not pass screening for vision or hearing, you may have a visit with the audiologist or the optometrist. Then you will have a Part 2 appointment booked with a flight surgeon who will complete the head-to-toe assessment. During that Part 2, you will also complete your periodic health assessment, Part 2. The form is then completed. It's an electronic form. It's submitted electronically to the Aeromedical Authority where it's reviewed. The flight surgeon makes a recommendation on whether you're qualified or disqualified. The Aeromedical Authority actually is the qualifying body. So you may get an upslip or a downslip by your flight surgeon. It still may be disqualified or qualified at the Aeromedical Authority and sent back to that flight surgeon for a correction or more information. And so those actually, before the reviewer at AMA gets it, is coded. Any medical conditions are coded by a coder, and then they're reviewed by a reviewer.
I think that's great information for folks to have, especially new personnel. Personnel that are already on flight status will receive temporary duty upslips or while they're waiting on waivers. We get a lot of phone calls for our first-time flight physicals.
Because people feel like I went to the provider's office and they gave me a piece of paper, so I must be good, not realizing that 3 or 4 months later, you may get a call from that flight surgeon's office that, hey, we've had a little bit of a hiccup. We need you to come in and clarify a few things.
We've talked about RTC and walks, but there are folks that are at military academies, and they should be able to see the clinic that's closest to them for flight physicals. If not, they need to go find an Army flight surgeon or a clinic to do flight physicals, correct?
To my knowledge, all of the Army academies have flight surgeons that are integral to them.
Oh, perfect.
More than one.
Yes, they should. Again, just the October date is a hard date that cannot be changed. So I know some folks know they want to be pilots for their entire lives and will have their flight physical done before camp, but do not wait long. Could take up to 3 to 6 months to get approved.
Right. If you just watched Top Gun and said, hey, that life is for me, and you're not in a Navy academy and you're at an Army academy, you better get going.
As we wrap up for our first episode, what is the best advice you can give for future aviators planning their flight physical? I think you've said it several times during this, but...
Number one, know when your birthday is. No, really, it's to be open and honest in all of your medical history. Transparency is key. There are people you will encounter in your military career. They may be family members who will tell you, oh, you shouldn't tell your flight surgeon that because that's going to limit your flight career. Your flight surgeon is not your enemy. Your flight surgeon is probably your best advocate for your career-wise. If you have a condition that is flight limiting, your flight surgeon is going to be the one who can tell you the ways to mitigate risk and to fight for a waiver for you. To willfully not report conditions is the first step in making sure you don't have a flight career.
That's excellent information. And then thank you so much for joining us today.
No problem.
Episode 2.
Today we're going to be talking about how to book a flight physical. Oftentimes, as probably many aviators or personnel in flight status have found, is there are some nuances when it comes to aviation medicine and flight physicals that aren't necessarily the same way that you would book just a primary care appointment, even if a flight surgeon is your primary care manager. Today, I'm lucky enough to be joined by Liz Johnson-Bailey.
Hi, I'm Liz Johnson-Bailey. I'm an aerospace medicine physician assistant.
Ms. Johnson-Bailey, can you walk us through a little bit about how to book a flight physical specifically, or what is the process?
Okay, so if you are applying to aviation, the first decision to be made is, are you applying to be a warrant officer or an officer? There's a 1A physical and a 1W physical. W is for warrant, A is for officer. Officers are people who have completed college or they're going through officer candidate school. W is a applicant who may have been in high school or had some college, but they're going to go through warrant officer training. They have 2 different application pathways. The physicals are similar, but they go to different boards. And so if you come in, when you call to make that appointment, you need to let the clerk know, I am applying to be an officer, commissioned officer, or I'm going to apply to be a warrant officer. Most of the time, the warrant officers do have a recruiter that sends them here for that. That may not always be the case. If you are enlisted, most of those people tend to be going for a warrant officer packet. You can let them know that. For enlisted personnel who are going for a crew member physical, you need to let us know if it's what class of crew member. Are you going to be a flight medic? Are you going to be a mechanic? We need to know what is the job you are seeking so we can put you in the right class of physical. If you're an air traffic controller or a UAS operator, those things matter. You don't have to know the class, but you have to tell us what the job is that you're seeking so we can make sure you're booked in the right physical. If you don't have the right physical, your physical will be disqualified once it gets over to AMA because it's the wrong class. You will call to make an appointment. At Lyster, that number is 1-800-261-7193. Tell them I need to book a flight physical for Part 1. And when you come in for the Part 1, make sure you have that information with you. If you have previously had a flight physical, you're doing an annual physical. You'll do that during your birth month. If you've missed your birth month for some reason, be prepared for additional information to be needed. If you wear glasses, make sure you bring your glasses to that appointment. You can't do a vision screening without your eyewear. Do not wear contact lenses to that appointment. We need your glasses. If you have had a physical in the past, you may want to bring your last copy of your physical so that we can have all of the information from your last physical so you can update your medical record. If you are already established in aviation, you want to go ahead and get yourself Aero Self-Service Access. That is where you as a service member can access your flight physical records in the Aero database, which is where all your flight physicals and waiver letters are held. That's at aero.health.mil. You will need a CAC-enabled computer to get that access. If you're an applicant to find out, hey, is my physical qualified yet? Hey, where do I get my letters for any copies of waiver letters? Oh, I need a copy of my stamped physical. All of those documents are in that database.
That's excellent information. You mentioned enlisted soldiers. I'm assuming you're talking about folks that are already enlisted that are trying to do an MOS reclassification or become a warrant officer?
Yes.
Do folks that are joining the Army do flight physicals before they ship to basic training?
So if they are enlisted joining to become an
UAS
aviation
operator.
or
Yep.
UAS or ATC, they will have their physicals done at their AIT station.
Perfect.
And another nuance too, if you are at Rucker for flight school, like you've just completed walks, those physicals are not booked through our 800 number. Those are booked through the flight school themselves. They will put you on a list and you will come over and they batch you. You do not have to call over here to schedule that appointment. The schoolhouse will tell us when you are coming over.
That's excellent news. There's a new MOS for enlisted that's called 15 X-ray. They do not require, it might be misnomers right now. Right now, they do not require flight physicals.
At this time, no.
You said a lot of things. Oftentimes, even seasoned aviators forget items when they come to an appointment, but you mentioned glasses. Are there some other items that folks should have with them?
If
when they come to
they
the
have
appointment?
completed a specialty evaluation for a waiver requirement, they should bring copies of that letter from that offsite provider, any offsite records that they know that they're going to need. For example, if they have a requirement that they see a GI specialist every year, bring that letter with them. If they have cardiology notes, bring those letters with them.
Now, can you kind of describe a little bit about how, I know we've talked a little bit about it, but can everything be done in one day, or are there different levels of appointments that need to be done, such as a part 1 and a part 2?
Typically, for non-flight students, we do a part 1 and a part 2. In rare instances, we can do a short physical same day. It is generally not done unless it's a rare occasion. And that is a person who has no waivers and perfect health. And we're actually even exploring some cases that there can be done virtual visits. That is a newer pilot project right now. Pilot as in new project, not as in a aviator pilot.
I know you mentioned waivers. So one of the common mistakes I see, at least at Lyster, is personnel will book their part 2 flight physical right when they're done with part 1, but might not be ready to do their part 2. Can you elaborate upon what that looks like a little bit?
Okay, so for physicals, you have a qualified physical or a disqualified physical. So say you didn't meet a medical standard and you are disqualified. That doesn't necessarily mean you won't become a pilot. It means that there may be a waiver process. For example, if you have hypothyroidism, which is a condition where your thyroid hormones are low, and you get medication, and that brings you up to our normal thyroid level, and we've reduced any risk of an aeromedical event that could be incapacitating, you can request a waiver. You're under the care of a specialist, your levels have normalized. We say, okay, you're corrected. We will give you are disqualified with a waiver to continue with aviation. The waiver has a requirement every year that you have lab work done. As long as your lab work shows that you're at a normal level, you can continue that waiver. So you have to do that as part of your physical. Some waivers will require maybe you have an evaluation with a specialist every year. So that's the biggest difference on why some physicals cannot be done in one day. You may have to go off post to a specialist. It may be a specialist that's a higher demand specialist or harder to find, a non-local specialist. Some people may have testing that has to be done every year. Maybe you have an eye condition that's not something an optometrist sees, it's an ophthalmologist sees it, and they're off-site, and you have to do some special eye tests every year. Those are the things that you have to have done between the part 1 and the part 2 for us to be able to complete your physical.
Perfect. Now, we've talked about this a few of our other episodes, but flight surgeons are not the final approval, so it goes to a different area to be approved, and waivers often require specialists to approve those waivers in addition. But obviously, a lot of our listeners are probably interested in how they can track the status of their flight physical.
Okay, so I did mention the aero.health.mil site. That is where your information for your flight physical is tracked. Now, as a user, it doesn't give you a whole lot of information. It'll say in progress, in progress. Your flight surgeon has the most information. Does it help you to message your flight surgeon every week? Hey, what's the status of my waiver? Not really, because waivers don't move quickly. What helps is knowing, has my waiver been requested? First of all, have I done everything I needed to do for my waiver? Your flight surgeon has what's called aeromedical policy letters for most conditions, and that is the checklist of what's required for each condition in order to request a waiver. If I have this condition, I have to do these 8 things, and those evaluations have to come back, and then my flight surgeon can write a medical synopsis that says, yes, all of these things have been done, and the condition is stable, we recommend a waiver. That synopsis is sent electronically to AMA. It is coded by a coder, It is reviewed by a reviewer who agrees or disagrees with the flight surgeon's recommendation. They put some additional data into it. It then goes to a ACAP, which is a board with maybe pilots, other providers. It may be a specialist in that field of medicine. If it's a blood condition, it's a hematologist. If it's a brain condition, it's a neurologist. And maybe an SP or an IP of that type of airframe. And the director of AMA. They meet collectively. What is the risk of this condition having an event? What is it? What's the likelihood of getting maybe the 10 years out of this aviator's condition? What's the risk of putting this person in the aviation field and the condition progressing? All of those factors are taken into account and an ACAP is held. Then, a vote's taken, yes or no. Then it goes to, if it's National Guard, to the National Guard person who votes. Active duty goes to HRC. If the waiver is approved, a letter comes back to AMA and is posted in the Aero database, and it goes back to the flight surgeon to let you know you've got your waiver. The waiver letter also will have what your annual waiver requirements are for your physical. And so that process can take, depending on if we have to consult with a specialist, it can take several months.
No, thank you so much. And that's where I do think it's important for our listeners to understand, if they are new, to really allow 6+ months for a flight physical. You've mentioned the word AMA a few times. Can you kind of describe, I know AMA is the one that approves or disapproves flight physicals, but can you kind of describe what they do or who they are?
So AMA is the Army Aeromedical Authority. It is the governing body for Army Aviation. They write the standards, and we are the regulatory body for aviation medicine.
Perfect. I also think it's important for our listeners to understand that while they are stationed on Fort Rucker, they are a separate entity from Lyster Army Health Clinic.
I
know that gets
also,
confusing sometimes.
What's interesting about AMA is we also have the Aeromedical Epidemiology database of all conditions from the beginning of aviation. So if someone were to ask, how many waivers have we given for low back pain for rated aviators, we can pull up and give a count of how many aviators we've had and how many years have they had waivers for things. Somebody said this morning, how many waivers have we given for this bleeding disorder? And that database pulls all of that information. And so we can determine statistics and how many people have flown with this for how long.
Oh, that's amazing. I did not know that database existed.
And basically, it's about mitigating aeromedical risk to less than 0.5%, that this condition can cause an in-flight event that can be catastrophic.
Right, and I think that's important too for folks to understand is everyone operating the aircraft does carry a lot of risk in general because they have cargo in the back, and oftentimes that cargo is human.
Or even on the ground.
Yes.
It's not only the people in the aircraft, it's people under the aircraft. It's everything.
And I've found too the folks that are approving really do try to get to yes if risk can be mitigated.
It's about the risk.
So, before we wrap up today's episode, do you have any final thoughts you want to leave our listeners with?
That we're partners. We're partners in medicine, whether we work at a clinic and we're a flight surgeon, whether you're a patient, whether we work at AMA and we review work of others, that it's a partnership.
Perfect. And I think it's just also important for, and you've said it now in multiple episodes, is remember your birth month.
Don't forget your birthday.
And book early.
Episode 3.
One of the most common questions we hear at Lyster is, why isn't my flight physical done yet? Many aviators assume the delay happened at the clinic, but the reality is that flight physicals involve multiple steps, multiple reviews, and sometimes factors completely outside our control. Today, I'm lucky enough to be joined again by Major Pentinari and Liz Johnson-Bailey.
Hi.
Hi,
Again.
Thanks for having us again.
So today we're going to discuss some of the most common delays of flight physicals and why they happen. So Liz, for someone getting their first flight physical, can you walk us through the process from start to finish?
Okay, you're going to call 1-800-261-7193 to book a Part 1, only if you're at Fort Rucker, because we're not going to book you if you're not at Fort Rucker. You will be booked for a Part 1 exam where you'll see our physical exam staff. You'll complete a 2807-1 and a 2808. You will then go through a vision screening, a hearing exam, Any appropriate lab work will be ordered. You will complete your online portion of your periodic health assessment, and you will be booked to part 2 with a provider. Then you'll come in for an appointment with your part 2 and see your provider. If you are a go with everything and you have no additional information, your information is electronically submitted to the Army Aeromedical Authority. And depending on the type of physical, if you are a rated aviator, you get an upslip. If you're a student, you may get an upslip depending on if you've applied and you're going to school. If you're an applicant, you will not get an upslip. AAMA will review your physical and determine if it's qualified or disqualified. So things that can delay that process. If you go to the part 2 and you need further workup, if you have omitted something from your history that is found during your electronic health review, and we need to refer you off post. If you were seen sometime during the year and you were referred for an evaluation that you never completed it, if you didn't complete your lab work, if your lab work was abnormal, or if AMA reviewed your physical because your flight surgeon said it was qualified and we have found some additional information and need additional information from your flight surgeon, we can return it as disqualified, incomplete, waiting on for information from that flight surgeon.
I would say from a mental health standpoint, if a flight surgeon refers you to behavioral health, and this is an initial evaluation, one of the things that we will look at is obtaining any off-post records. And so one of the holdups in mental health is if it takes a long time to get those off-post records, we will not book here at Lyster until we have those records, which could contribute to the delay time.
That also holds true for off-post records for consultation notes too.
No, thank you for all of that. And you've mentioned AMA several times, but many aviators probably still think their flight physical is complete once they walk out the door.
Unfortunately, no. It has to go through a review process.
How do specialty consults sometimes affect the length of a flight physical?
So it really depends on the specialty itself. If it's a commonly sought after specialty that we have a lot of local availability, a few things that you can do to help those records get sooner is, one, once the visit's complete, ask, when can I pick up records to bring to my flight surgeon? You can submit those through your electronic health record to your flight surgeon to review, and then they become part of your record. It does take a delay. Humana has 30 business days to get those records to us, and they are only required to send the first visit on a consultation. So if you've seen a specialist multiple times, it is much easier for you as the patient to get the record to bring it to us than for us to wait for every time we get a records request. On certain specialty evaluations where there are not local providers that you're maybe traveling to Birmingham or Atlanta or Florida Panhandle, they're not as local as Enterprise proper. I would recommend also getting those notes and bringing them back. There are some people who will be sent to another military treatment facility. Those notes we tend to have immediate access to as soon as they're written. So they're not as hard to obtain.
I would say it's almost imperative for the soldier to get those notes as quickly as possible, because that's where I see as the biggest delay, is the time it takes to get those off-post records.
And not just
we'll get the appointment and then get the record so that we can get it uploaded into the chart and available for the flight surgeon and ALMA.
And sometimes not just notes, but also results of diagnostic testing such as MRIs, lab tests, or any specialty screenings done in those offices.
What medical documentation do most aviators forget to bring to their appointment?
All of it.
Their eyeglasses. So if I had $100 for every time it's in their car, I was like, well, that's great. I hope that car is here today. Did you not just come out of that car?
Are waivers typically the biggest cause of the delay?
I would say yes, because if your physical doesn't require a waiver, nothing stops me from submitting it, within a day or two after you leave, if not that same day. The waivers are the things that are more time consuming, because if you think about it, it's kind of a mini medical board on why you should stay in the aviation field. I have to justify what is your job, how are you important to aviation, and why this condition. Even though you have this condition, it's not risky for us to keep you flying.
Perfect. Talk a little bit about some of the myths and misconceptions. Now, we've talked about it in a previous episode, but true or false? If I do not require any waivers, my flight physical will be approved immediately.
False. It still has to go through ALMA. So your flight surgeon will complete the evaluation, upload the aeromedical summary to Aero, and then it goes to ALMA for review.
True or false? If I wait until the last minute, the clinic can always get me done before I expire.
False.
Absolutely false.
But
And
if you are still within your birth month, you can come in for a one-time 30-day birth month extension in which you have to complete your physical before the last day of the next month. So that means if your birth month is February, you have to come in before the last day of February to do that. You cannot come in a March 1st if you have a February birth month to ask for an extension.
True or false, one of the biggest delays is personnel not scheduling their appointments if they were referred for a consult.
True.
true.
We've mentioned waivers several times, but what can patients do to help expedite waivers?
They can ask their flight surgeon what the waiver is for, what condition is disqualifying, and what are the requirements for the waiver. We can give them a copy of the aeromedical policy letter. Now, sometimes that can be a catch-22 because I've had patients go, well, this doesn't say that exactly. And I promise that I am the aeromedical expert on this, and I can tell you exactly what's required and what's not required. You can, by all means, ask me, so what does this mean? And I will write out, you need this test, you need this consultation, you need these results. And at that point, once all of this list is done, we will request your waiver. I think it's very difficult as a patient to be like, wait, what do I do? Do I sit here and wait for something to come in the mail? When as a provider, I can give you a checklist. And, aviation people love these checklists. You have a checklist to start your aircraft. You have a checklist to work a tower. Ask your flight surgeon, what is the checklist to manage my condition and how to get this waiver?
Now, as we wrap up today's episode, done probably 30 or 40,000 flight physicals possibly, or looked at in your career?
I've done 16,000,
Excellent.
but I've qualified about 28,000.
That's awesome. What's the fastest flight physical you've ever completed,
Oh, like
or seen completed all the way through the process?
from seeing the patient to being qualified, probably about 22 minutes.
That's awesome.
I mean, when AMA was on the other side waiting for the physical.
That is a very rare case, however.
That doesn't happen
and-
anymore. Like perfect patient, no history. It
No.
still can happen very quickly. I mean, we've had some that get approved the very next day. It just kind of depends on what's in the mix and what's going in. Now, realize that at AMA, we process about 3,200 physicals a month and about 600 waivers.
Excellent. Do either of you have any firsthand experience going through flight physicals, and what is one of a delay that might interest some of our listeners?
So this is going to date me. Back when Top Gun came out, I was a medic in the Army, and I said, you know what, I could probably fly aircraft. And I went, and I lived in Florida, and I went to the Navy, and I did a flight physical. And they did flight physicals on Thursdays, just like we do, which was kind of funny. So I checked in. I was starving, and I had my blood drawn. And the first thing you do in a Navy physical is you go and you do your vision. And I have 20/15 vision, and I'm like, I'm going to nail this. And I go in, and I have 20/15 vision. And the next thing is the little slide box where they check your depth perception. And that's the little circle test for people who don't know what depth perception is. And so the corpsman says, which circle is closer to you? Well, I'm a concrete thinker. And I'm like, this is an idiot test. All of the circles are on the same card that you slid in front of me. And I'm like, none of them are closer to me. They're all on the same card. He's like, no, one of the circles is closer. Tell me which circle's closer. And I'm like, I don't know. He's like, well, if you don't know, then guess. So I said, right. He goes, wrong. Puts another card in there. He goes, which circle's closer to you? And I said, left. He goes, wrong. Take your packet and go to the front desk and sign out. And I'm like, but you have my blood. Well, in the Navy, they don't give waivers like we do in the Army. In the Army, if you had failed depth perception, you would have had like 3 other tests. And then you would have seen the eye doctor, and the eye doctor would have said, hey, you can have a waiver for that. Well, of course, I don't know this till 10 years later when I'm an Army flight surgeon student, and I go, I could have gotten a waiver for that. What really was the option is the corpsman didn't give me the right instructions for the test. He was supposed to say, glance quickly across the row of circles and tell me which circle appears differently. So I think the lesson to take back from this is to communicate with the person who's either given you instructions if you don't understand, or your flight surgeon. Communication and transparency are key. I guess it's probably good that I wasn't a Navy pilot because I kind of suck at flying. I figured that out after going to the flight surgeon course. I'm not really meant to
In
be a
the
pilot.
simulators?
In the simulators, yeah, it was terrible. There's a colonel on post that I flew with who told me that I gave her motion sickness, and she doesn't get motion sick. But anyway, I'm a much better flight surgeon than I am a pilot.
Well, I think probably
And I have a couple of waivers myself, but the Army was easy about getting waivers.
Well, I would assume the aviation community is very grateful because at this point you've probably done the flight physicals of half of the force.
Maybe. I've done grandchildren of pilots flight physicals, and children of pilots flight physicals that I know.
As we wrap up today for each of you, what is one thing you would like our listeners to take away from this episode for preventing delays to their flight physical?
I'm going to say transparency and partnership, like I said the last time.
I'll change up mine a little bit and say ensure that you are diligently working to get records from off-post entities so that your flight surgeons can process your physical.
Thank you. And they've heard this in other episodes, but remember your birth month and book early.
Episode 4.
Today we're going to talk about Flight Surgeon of the Day. Today I'm lucky enough to be joined by Liz Johnson-Bailey.
Hi, I'm Liz Johnson-Bailey. I'm an aerospace medicine physician assistant.
Ms. Johnson-Bailey, can you describe a little bit about what Flight Surgeon of the Day is and where folks may find it?
So when I worked at Lyster, Flight Surgeon of the Day was my favorite day in clinic because I didn't have patients scheduled every 10 minutes. Actually, it wasn't every 10 minutes. It was probably every 20 minutes. So Flight Surgeon of the Day was a day that you were dedicated to walk-ins, which are actually scheduled. But it was a day in which it allowed flight crew to come in and expedite their processing a little bit. So if they had been seen by the ER, or if you had a minor acute illness and you had been grounded recently and you needed an upslip right away, or if
I just want to pause. Can you describe what acute means in medical terms, please?
So acute is 1 to 3 days, self-limiting, that maybe I had the sniffles. I couldn't clear my ears, so I couldn't fly yesterday, but I'm feeling 100% better today, and I need an upslip today. I went to the ER yesterday, and I got some sutures in my arm, and I got grounded yesterday. My arm is not one of my fingers, so I have full range of motion. It is not covered by an area that's going to be sweaty. It can be protected. I can fly. I need an upslip to fly today. It may be something that I just PCS to Fort Rucker and I need my in-processing upslip because I have to get an in-processing upslip within 14 days of reporting to a new duty station.
I want to just put a plug in right now. This is not specific to every installation, so you're listening. We are here at Fort Rucker. But recently, we have implemented a QR code to request a new duty upslip for in-processing that folks in most circumstances will not need to come in here and should expect from the time they submit their QR code a new duty upslip if they do not have any issues back to them within 5 business days.
Just to show that we're constantly evolving. Another thing is convalescent leave. Maybe you had a minor procedure or a surgical procedure, and we don't want you to have an appointment after being in the surgical suite all day. Your spouse or someone, a designee of yours, can take your ID card and your discharge papers, come in to see the flight surgeon of the day. They can issue your down slip, they can give you your convalescent leave and pick up your medications, and while you are convalescing at home. If your commander has said, hey, you are too sick to fly, go to the clinic and get a down slip. Or if you have determined, I am too sick to fly, I'm a student, I probably need to have a down slip today, you can come in. That is Monday, Wednesdays, and Fridays from 8 to 11.
At Fort Rucker.
At Fort Rucker.
I know a lot of locations that have combat aviation brigades will typically have a medical officer of the day or a flight surgeon of the day that folks can come in for acute issues. But if you're at a location that only has one flight surgeon, they may not have.
They may be
like
tired.
And we may have a lot of new aviators on here. If folks go to the ER that you mentioned or are sick and don't get a down slip, could you also describe kind of what is supposed to be done and why FSOD might be important to them?
So if you have sought care from anyone who is not a flight surgeon and not notified your flight surgeon, you are in violation of AR 40-8 and 100-105, which specifically says, anytime I am seen by a non-flight surgeon, I must notify my flight surgeon. That also includes if you are sick in quarters. Now, if you are seen by your flight surgeon, of course, that doesn't apply. They are aware of your care. But that includes if you are seen at sick call by a non-flight surgeon. That includes if you're seen off-post at urgent care. if you are seen at behavioral health and have not notified your flight surgeon, it's easy to do today. You know, we have this electronic messaging system. You just send your provider, hey, I was seen in the ER last night. I had an ear infection. They gave me this antibiotic. The provider's nurse will message you back. You are grounded, or you may stay up, depending on the type of situation it is. I like to send these little messages out. Hey, I got this, because believe it or not, urgent care and ER send us notes that you were there. So 3 days later, you might get a message if you have not notified me, hey, I saw you were seen in the ER and you forgot to tell me. And I might let you slide the first time, but I'm probably going to have a little discussion with you that, hey, this is actually written on your upslip. It's written on every upslip out of Fort Rucker in the comment section. So if you've never read the comments, you probably should read it, because it says, I understand, I must notify my flight surgeon.
It's all great information, and sometimes needs repeating. It's also important to understand where you do say my flight surgeon, but it doesn't necessarily need to be their flight surgeon, as long as a flight surgeon.
Right. And that's why I just send that message. Even if your flight surgeon's out of the clinic, someone is responding to those. And those are things that we use. When you have arms inspections, we have people that come and say, hey, are you doing all your aviation procedures the way you should be? And they're going to look and say, hey, was this pilot grounded after they were seen for surgery? And if there's not a downslip, we get a gig on that. And if you get so many gigs, our aviation programs are put at risk.
Oh, that's very interesting. I think. Do you have any final thoughts on Flight Surgeon of the Day before we close out?
Flight Surgeon of the Day helps you get seen sooner, especially in those birth months that are really high. There's a lot of baby. For some reason, there's a lot of cold months that, like December and January, which relate to high birth months in August and September. And so those are the times that it's hardest to get an appointment. And that's where the Flight Surgeon of the Day makes it easier for those minor things to be taken care of quickly. Yep. You know, I've had patients that tell me, oh, I can't get in to be seen. I've called and called and called. And I'm probably going to call you out on that a little bit if we have a Flight Surgeon of the Day program. So try that. It'll probably work better for you.
Flight Surgeon of the Day is an incredibly important program to deal with those acute issues that are simple. I know when we stood it up, it took care of a pretty significant backlog and several $1 million of lost training time.
Right. And at the same time, be realistic about it too. If you've been working on like 5 waivers and you've been grounded for a period of time, it probably is not going to be fixed in a 5-minute appointment. You know, make that follow-up appointment when you know you need to follow up for multiple things. Those are what those appointments are for. But if it's a quick, let's take care of this, we can get you back up, by all means, come on in.
All right. Thank you so much. That's all great information.
Episode 5.
Too often, conversations about mental health are surrounded by misconceptions, uncertainty, or concerns about career impact. The reality is that maintaining psychological health is just as important as maintaining physical health. In today's episode, we'll discuss common stressors facing aviators, when to seek help, and how aviation psychology helps keep our force healthy, resilient, and mission ready. I'm joined by 2 of our experts in this arena. I'm joined by our Deputy Commander of Clinical Services, who also happens to be our aeromedical psychologist, Major Daniela Pettinari. Welcome back to the series. And we have a special treat today. We're joined by the Sergeant Major of Lyster, Garrett Cleland, whose specialty in the military happens to be a mental health technician. So welcome.
Thanks for having us.
And I know, Sergeant Major Cleland, can you talk a little bit about some of the misconceptions that might be out there about seeking behavioral health?
So this is one of the struggles in the Army. You hear everyone talk about stigma and the dangers of seeking mental health. Of course, there are different processes that mental health can relate to in your career, whether it relates to your security clearance, profiles, medications, things of that nature. But really, when we're looking at the aviation standpoint, there's more risk associated with not seeking help than there is with the process of seeking the help that's needed. And ma'am, from your standpoint, Major Pettinari, can you talk about some of the challenges and how it relates to not seeking treatment when working with a flight status and things like flight physicals?
Yeah, from an aeromedical psychologist's perspective, what we're really looking at is risk. And so I'll tell a little short story here, just in terms of my personal experience. At my last duty station, I decided I was going to pursue a private pilot's license. And so I started flying a Piper Cherokee. And one of the things that surprised me the most in my flying journey was the amount of cognitive power required to fly an aircraft. And it completely changed the way that I looked at aeromedical psychology, because at the end of the day, our goal is to keep aviators in the air, but also be mindful of the risk involved in flying. When somebody experiences stress or sleep deprivation, that impacts cognitive power. And so we may see a decline in attention. We may see decline in processing speed. We may see decline in working memory. So essentially being able to remember the information that's communicated to you over the radio. And so we're constantly having to multitask in the aircraft. And so it's incredibly important to make sure from a mental health perspective that we're taking care of ourselves and really ensuring that before we get into the aircraft, we are performing at our best. Did I answer your question?
You did, ma'am. And to just follow up on that, so something that I've always heard when it relates to mental health and your wellness is looking at your oil. So it's essentially your occupational, your interpersonal, and your leisure activities, and figuring out when you cross the threshold into something that's problematic. So, ma'am, with resiliency being on a spectrum and everybody being different with how they react to common stressors, when do you feel like the appropriate level is for someone to seek treatment for a problem that they're experiencing?
My recommendation is to take a prevention mindset. So when you first start noticing, hey, something's not quite right, hey, the last few days I haven't been getting sufficient sleep, if your built-in coping strategies, healthy coping strategies, are not working, I would encourage somebody at that point to seek additional resources. I think the biggest misconception when it comes to psychology or mental health and aviation is that if I see behavioral health, I will never fly again. And that's really not the case at all. There are plenty of people who are on flight status and also seeking therapy. When it becomes a problem and a service member gets grounded is when symptoms have gotten so severe that they're difficult to manage on your own. And at that point, then we're really looking at the risk of flying.
Thank you for that discussion from both of you. I mean, it's well known that aviators often carry the most precious cargo, so it's incredibly important that they are at the top of their game. Can you tell our listeners a little bit about more what a normal life stressor is versus a mental health condition that somebody should seek help for?
The way that I like to differentiate that is when it comes to functioning. So when somebody is experiencing a normal life stressor, they're still able to go through their day, maintain their relationships. You don't see occupational impairment. They're maybe just having a bad day, essentially. When it becomes a mental health concern is when functioning becomes impaired. And so when we think about impairment, it's whether you're just not able to do your job, it's impacting the way that you do your job. It's impacting relationships. Relationships are becoming problematic, or there's other areas in one's life where it's just difficult. So maybe you are used to getting up at 6 a.m. and rolling through your day, and every day that's becoming harder and harder. And so maybe you're sleeping in. Maybe you start forgetting things at work. Major tasks that typically you have been able to accomplish on a day-to-day basis. So from a behavioral health perspective, we're really looking at the functioning of an individual. Your general day-to-day stressors aren't necessarily going to cause significant impairment. Everybody reacts different to stress. If you are having a bad day and something is off and you're supposed to fly, I would come up on the net and be saying something to your leadership, because any distraction can impact flight. And I think that's the ability to recognize that and then do something about it is one of the best things you can do to protect yourself and the people in your aircraft.
Yeah, that's a great point. And you did mention come up on the net with your leaders. What are some things that leaders can do to create an environment where their folks feel comfortable seeking help and they see it more as a strength than a weakness?
So from my perspective, I think this is finding the balance, because if you have a subordinate that comes to you and they say, hey, I don't feel comfortable flying today because I'm dealing with these things, you have to figure out what the balance is as a leader between making sure that that person has the resources and the time they need to take care of themselves while also maintaining the safety parameters associated with flying. So I don't think that there's, one size fits all for each leader in a specific environment, but I think it's about knowing your people.
I think that's a great point, Sergeant Major. I really think it's important for leaders at all levels to know their people. I think sometimes we just get caught up in the daily grind of what we have to do, that sometimes we forget the human element of our formation. There's task after task, mission requirement after mission requirement, and it can be really easy to get so focused on that we forget sometimes to check in our people, to maybe, I might notice, hey, there's something not quite right going on with you, but instead of pulling you aside and being like, hey, are you doing okay today? I get so caught up in my task, right, that I'm supposed to do. And I think if we can place more emphasis on the human side, we would be better at intervening.
I think that's why it's so important to be present as a leader, because if you lead via email, you're not going to be able to see the eyes of the person that you're talking to and understand if something's different or if they look different than your normal interactions with them. And that's really how you at the ground level, determine if there's concern, risk, or additional support that's needed.
Yes, our major always says, don't be a closed-door leader.
I do say that all the time.
Open the door and make sure you know your people.
No, those are both great points, and I do want to circle back a little bit. So leaders need to routinely communicate, and I know the stigma has been there for years that if you seek behavioral health, you will get grounded, and you've mentioned it several times today that is not the case. We've mentioned in other podcasts that the reality is the flight surgeon and the aeromedicine psychologist want to find ways to keep folks up.
I know we've talked a lot about stigma, and I know there is stigma when it comes to aviation specifically. But the reality is that, one, if you seek mental health services and you don't meet a diagnosis, a major mental health diagnosis, then you're likely going to remain on flight status. If you do meet criteria for a mental health diagnosis, you will likely be temporarily grounded. My expectation is that folks would go through a trial of treatment. And generally speaking, what we see is once people go through treatment and demonstrate improvement, they're going to get back up in the air. It's very far and few between that I ground somebody permanently unless there is some serious mental health illness going on. And so I would just encourage people that if something's feeling off, get the help you need early, because oftentimes treatment will be shorter.
Okay. We have a multitude of listeners on here. A lot of them are new folks that are trying to join Army Aviation. Can you talk a little bit about it? Was it imperative for them to know when it pertains to talking a little bit about any past mental health experiences?
What I'll highlight off of that is, and I know I've spoke about it in other podcasts, with our new Genesis system, we can see historical records. And one of the things I see when I do initial flight physicals or Aeromed psych evaluations is that folks will omit information because it's no longer relevant. So, for example, I was diagnosed with ADHD when I was 7 years old. I was prescribed medication. I stopped taking medication when I was 10 years old. ADHD is no longer an issue, so I'm not going to disclose it. As a provider, I can go into Genesis and I can see that you were prescribed ADHD medication, have a diagnosis of ADHD, and from a flight perspective, that is absolutely relevant. and it's going to dictate what we do in terms of the assessment. And so I would just ask that folks, even if you don't think it's relevant, please don't omit it and be forthcoming in terms of discussing the entirety of your medical record, both physical medicine and mental health, because we can see it.
But before we wrap up today, is there any other myths that you'd like to dispel for our listeners?
The only other thing I would want to add is related to mental health medications. And an individual on flight status can be prescribed certain psychiatric medications. It doesn't necessarily mean they'll never be able to fly again. What would happen is once that service member is prescribed medication, they would be placed on a downslip temporarily until they were able to reach a period of stability. So when we were looking for about a 3 to 4 month period of stability on a medication and dose, and once they've reached that therapeutic dose, we would then conduct an Aeromed psych evaluation and get them back up in the air. But just because you're on a medication, just because somebody recommends a medication doesn't mean that you'll never be able to fly again. It would essentially lead to a temporary downslip and then a reevaluation to get back up in the air.
I just want to add into that, just ensure if to our listeners that if you are given a medication and your flight surgeon or aeromed psychologist does not know about it, please make sure that you let them know.
Yes, so if you get prescribed any medication from somebody on the outside of a MTF, please, regardless of what medication, whether it's a mental health medication or not, please inform your flight surgeon.
Before we close out today, what is one thing you'd want every aviator to know?
Personally, I would just say, just like you have rest cycles that you need in order to fly, you also need that for your mind too, to make sure that you are in optimal performance mode to be able to do what you need to do when you're in the cockpit. As Major Patinari said, being forthcoming with information is truly important. It's much better to be forward about the information or challenges that you're having than deal with something negative on the back end because you didn't get the proper treatment that you needed whenever you needed it.
I agree 100% with Sergeant Major. What I'll add to that is when it comes to coping, establish healthy coping skills. Practice them when you're not stressed out, because if you don't practice them when you're not stressed out, you're likely not going to implement them when you are stressed out, and we tend to revert back to unhealthy coping styles. One of the most classic coping skills is deep breathing. And so, for example, when I sit with folks, I encourage them to practice deep breathing 3 times a day, any time of the day, for at least 1 minute. You have to practice coping in low-threat situations so that when you get to high-threat situations, you're more likely to implement.
Excellent. Thank you.
Episode 6.
Today, we're focusing on something every soldier in Army Aviation experiences but few truly appreciate: noise. Rotor blades, turbine engines, flight line operations. In Army Aviation, noise is part of the mission. But every takeoff, every maintenance run, and every hour on the flight line leaves a mark. Unlike a broken bone, hearing loss doesn't happen all at once. It happens quietly until one day the damage is permanent. Today, we're talking about protecting one of your most valuable mission assets, your hearing. Today, I'm joined by Lyster's Chief of Audiology and Chief of Specialty Services, Lieutenant Colonel Ellie Young. Ellie comes with a wealth of knowledge and has been treating aviators for over
17 years now.
Perfect. Ellie, can you tell some of our listeners why hearing is so important in Army Aviation? I know it's important in all of the Army, but particular Army Aviation.
One reason why hearing is very important in aviation is because of the amount of information that aviators are processing auditorily. So they are getting several different radio inputs through their headsets at the same time, and they have to be able to distinguish which one pertains to them and react to it appropriately.
Now, you said they're receiving several different noises, but would you say that hearing is pretty mission critical?
It is absolutely mission critical for aviation, yes.
How loud is Army Aviation?
There is some variation in the loudness levels of different aircraft, but basically all of them are producing over 100 decibels, no matter which position within the aircraft the aviator is located.
Do you happen to know which aircraft produces the highest noise levels?
In general, the Chinook is the loudest.
If I'm not surprised. Do you think the Cheyenne will be louder?
That is a great question. I haven't seen any data yet on the Cheyenne.
And then how quickly can damage occur?
Well, in general, we talk about two different types of noise. One is impact impulse noise, and that's going to be anything like your weapon firing and your explosions and things like that that are a sound that's less than half a second. Those cause instant damage if they're over 140 decibels. And when we're talking about rotary aircraft, they are a constant type of sound, so the damage tends to occur more slowly. However, anything over 85 decibels starts to do damage. So all of our aircraft are producing hazardous levels of noise. So even though we have hazardous exposures in aviation, that doesn't mean that hearing loss is inevitable. All noise exposure is preventable with the correct type of hearing protection.
That's great. I know. And you mentioned hearing protection. Can you talk a little bit about hearing protection for aviators? Because it's a little different than what I, as a normal Army soldier, would receive, correct?
It is. The communication earplug is a device that fits into the aviator's ear with radio communications built into it, and then it connects via cable to their helmet. And the ending on that, we call it a CEP, the ending on it can either be a foam or a silicone custom molded piece.
No, that's great. Now, it's my understanding hearing loss can occur without somebody noticing it.
That is true. Our brain is very adaptable, and so it starts to perceive sound, even in the presence of hearing loss, as normal to your brain. So once you start feeling like everyone around you is mumbling or muttering, that's usually one of the first signs that the hearing has depreciated.
Can you talk a little bit about what are some of the other early signs or warnings of hearing loss?
Some other things that can happen will be what we call ringing in the ears or tinnitus. And that is essentially the brain is no longer receiving the same amount of input. So it's trying to fill the gap. And for most people, it tends to pick something out that you've heard a lot in the past. So it'll sound like a high-pitched tone, generally speaking, and it can increase over time in how often it happens and how long it lasts until one day it turns on and unfortunately it doesn't turn back off again.
Perfect. We've talked a lot about folks inside the aircraft and pilots so far. What about maintenance personnel? Are they at equal or greater risk for hearing loss?
I would say that they're at least equal risk of hearing loss because the sound will, you could say, dissipate over distance. However, oftentimes maintenance individuals need to talk and communicate with each other. And so if they don't have devices that will pass through low levels of sound, like the person talking next to them, and they lift the hearing protection off of their ears or take it out while they're still in the presence of that noise, research has shown that putting hearing protection back on while you're in a noisy situation is never as effective as the first time it was put in. So they're introducing extra risk when they need to communicate if their device does not have that capability.
Thank you for that. And I think it's absolutely important, I think, especially for our young soldiers just entering that think they're still invincible, that they do wear the hearing protection that the Army provides, because it is about prevention.
Absolutely. And when they use the hearing protection correctly and they remember that they need to turn things down or move further away from the noise source, that's another way to help protect themselves as well.
No, perfect. Thank you. I think I'm going to ask you the question that I think is probably on everyone's mind, and as they listen to us so far, but I think is most important to those on flight status. Can hearing loss affect flight status?
If an individual has their hearing impacted either through previous noise exposure without proper hearing protection or have a medical cause for their hearing loss, it can affect their flight status, but there is a waiver process. So most individuals that have hearing loss continue to fly under a waiver condition. So we do additional testing to look at their overall hearing functionality besides just going off of a number.
Mm-hmm. No, that's great. So I think one of the most important things, I'm assuming, is for folks, if they are starting to notice any degradation in hearing, is that they get in and make an appointment with you guys' team.
That is true. It's very easy to make corrections when there's an indicator that hearing loss is occurring. Unfortunately, after it's been acquired, we can't correct hearing loss with the medication or anything like that.
Can you talk about maybe 3 things what soldiers can do today to protect their hearing?
I would say that it's important to remember what we call a time intensity trade-off. Now, that sounds like a big term there, but basically what it means is that the louder something is, the less amount of time you can be around it with and not achieve or acquire some hearing loss. For example, if you're going to the gym and you're exercising between 60 minutes to 2 hours, and you like to use your music to get you through a workout, then you need to turn down your headphones or your AirPods or whatever kind of device you're listening through, because while you're exercising, your blood flow gets a little bit rerouted from the ears to your lungs and your muscles that you're working out, and you're asking them to work harder. So the general rule of thumb to protect hearing while exercising is not louder than 60% of the volume and not for longer than 60 minutes at a time. Most individuals don't realize that the sound that they're exposed to over the entire course of the day adds up. So it might not necessarily be your work exposure because you've got your protective devices at work, but you got to think about your off-duty time as well.
Yes, my watch often goes to loud noises when my dog starts barking relentlessly. We're going to do a little myth or fact. If your ears aren't ringing, your hearing wasn't damaged.
That's false.
You only need hearing protection around running aircraft.
That would be false.
Noise-canceling headphones are the same as hearing protection.
Unfortunately, that is also false.
And you can tough out loud environments without long-term effects.
And that is very much false.
Perfect. I want to ask you, as we wrap up today, I just want to ask you a few scenario-based questions for our listeners. I walk across the flight line for 2 minutes without ear protection. Is that enough to matter?
Again, you got to think about the entire course of the day and how it all adds up. So, yes, it does matter.
I fly only occasionally. Should I still worry about hearing loss?
Anytime you are around noise that is over that 85 decibel limit, then yes, you need to worry about using the proper hearing protection so you don't acquire hearing loss.
I've noticed ringing after flying, but it goes away. Should I be concerned?
That is actually a good indicator that noise is getting through. You have to remember that sound is just like water. It will get through any crack. So if the hearing protection is not giving you a seal of your ear canals, then some of that sound is leaking through. And the brain is trying to tell you that with that ringing.
No, perfect. I know that you've been seeing aviators for about 17 years. What's the most common thing aviators tell you after they realize they've lost hearing?
They wish that they would have been better at changing out their CEPs regularly.
And then what's something you wish every new aviator understood before their first day on the flight line?
It would be important to realize that hearing loss is not inevitable. Noise-induced hearing loss is painless, it's progressive, but the main thing is that it's preventable.
Speaking of prevention, have you seen soldiers prevent permanent hearing loss simply by changing a few habits?
Absolutely. So anything that in that term generally goes back to what they do recreationally, and if they make some small modifications, just like turn that volume down a little bit when we're exercising or in the car, then that can help to retain good hearing through their whole entire life, not just their career.
Perfect. As we wrap up today, if you could leave our listeners with only one thing you want them to remember, what would it be?
I will have to reiterate that Hearing loss from a military service is not inevitable. And just like any other prevention method, a little bit goes a long ways. So moving further away from the noise source, turning it down, or using the correct hearing protection in the correct way is how they will be able to achieve that. There is a question that's often asked, what is the best type of hearing protector? And the answer is the one that you wear and the one you wear correctly.
No, excellent. Thank you so much for joining us today, Colonel Young.
And thank you for having me.
So, and to our listeners, just remember, you only get one set of ears. Unlike many injuries, hearing loss often happens slowly and silently, until one day you realize the sounds you once took for granted are gone. Whether you're a pilot, crew chief, maintainer, or simply working around Army aircraft, protecting your hearing today helps ensure you'll still hear tomorrow's mission and the voices waiting for you at home.
Episode 7.
In today's episode, we're tackling common myths. One of the most common questions flight surgeons hear isn't about a flight physical or a medication. It's this: if I tell you this, am I going to lose my flight status? Today, we're talking about the myths, the facts, and what every aviator should know before they walk through the clinic doors. Joining me today is Major Patnari and Miss Liz Johnson-Bailey.
Hi, I'm Liz Johnson-Bailey. I'm an aerospace medicine physician assistant.
Hi, thanks for having me. I'm Major Daniela Petnari. I'm the Deputy Commander for Clinical Services, and I'm an aeromedical psychologist.
As you both are well aware, aviators are in constant fear of being grounded for medical issues. Let's start with the biggest myth you hear from aviators. What is the most common misconception about flight status?
That when you come to the flight surgeon's office, we are there to ground you. That is absolutely not the case. Actually, we spend way more time trying to keep you up in the air safely than I've ever spent trying to ground someone. Grounding someone is actually easy because all I have to do is go, you're grounded. It takes 10 to 20 times more work to keep you flying safely. Flying is actually a privilege. It's not a right. You have to meet criteria to fly, not only mental criteria, but physical criteria. It's regulation bound. There's quality metrics in all of it. If someone comes to me and says, hey, this is what I've got going on, I have due diligence to figure out what's going on and make sure that you can still do your job safely. I'll spend way more time trying to work with you through that problem than I ever will to tell you, hey, we can't do this anymore.
I know a lot of my friends that are aviators and folks I've been around think that anytime they get seen by medical, they're going to get grounded. But in my experience in a cabin within Lyster is most conditions can be worked and keep pilots in the air.
Absolutely. The military has spent so much time investing into that training to get you through flight training, whether it's an ATC, a crew member, or a pilot. They want that return on investment. We don't come out ahead if we train you to become a pilot and then ground you and you never fly again. We want to get that time out of you and get that experience out of you.
I know you and Major Petnari have seen patients a lot and have extensive experience. Why do you think so many aviation myths continue to circulate?
Once something starts, it's terribly hard to stop that information train. It's the barracks lawyers, the E4 mafia. We still have those rumors from when I joined. Hey, you don't want to tell somebody something. And, it's 50 years later and we still know these things.
I think from a mental health standpoint, there's always been a lot of stigma around mental health that's created some concern with seeking help. But from a flight standpoint, we encourage folks who are having increased difficulties coping to come in sooner than later before it becomes a diagnosis so that we can keep you flying. And I think in terms of mental health, the biggest myth is if I come to mental health, I'm going to be grounded immediately and I'm never going to fly again. And that's just not the case. I put more people back up in the air than I do ground. And a lot of that is folks are coming in, they're getting their treatment, they're improving, and they're just getting themselves back to a healthy and safe status. And so I think that really has to be articulated and to the community is that if you come and get help and there's improvement in your mental status, you are going to get back up. And so I just hope that that's something that we can continue to push out to the aviation community.
What do you both think are some medical issues aviators commonly worry about that don't often end up being major problems? I know you've already mentioned mental health, but there's quite a few others that I think some folks worry about.
Probably things that are very common, like back pain. I'm trying to think of things that are really common, that digestive issues, headaches.
TBIs, I would say,
TBIs
is definitely
are
a big one.
Yeah. Immune system issues. You know, we are seeing a larger populations with things like Crohn's disease, irritable bowel disease, autoimmune disorders.
Can you explain the difference as well between temporary grounding and permanent grounding?
So temporary grounding would be that you are grounded while we are addressing something that maybe you're on a medication or you're acutely ill, that we're going to take care of this here and now. I have a cold, I can't clear my ears, so you're going to be grounded until you can get that capability to clear your ears back. Now, you may also be temporarily grounded for several months at a time while you're being worked up for a condition. A grounding that becomes more permanent is if you have been grounded for 365 days. That is considered a permanent grounding. And then at that point, you will be considered for suspension from flight service. Now, if you have a medical condition that keeps you grounded for 365 days, you will be considered for suspension. But realize that suspensions are not always permanent. It may be called a permanent suspension, but should your condition be improved, you can be put back up after a period of time.
Is there ever a circumstance in which permanent suspension can be reversed?
Well, permanent suspension can be reversed when there has a preponderance of evidence that the condition has resolved or stabilized, a new aeromedical summary and waiver request has been submitted and approved. You can be returned to flight service. You will not be reimbursed flight pay for the period of time that you were suspended, but once that reversal is done and you are granted a waiver to return to flight service, your flight pay will be reinstated.
I know we've mentioned it several times during this podcast, but we have hopefully a lot of new listeners that aren't pilots listening to this yet. But what role do waivers play?
So a waiver says that you have a disqualifying medical condition that we know about. The condition has been evaluated medically by the medical experts. We have taken all the information about that disqualifying medical condition. We have said it's either treated or the catastrophic consequence it could have has been mitigated enough that we will now say you can fly with this waiver for your disqualifying condition. So now you are disqualified with waiver that you may fly.
I think another important thing to note about that is that if folks are going through the waiver process for that condition, for some of the conditions, they can be placed on a temporary upslip. And so I would encourage folks to speak with their flight surgeon or their aeromedical psychologist to see if that condition would qualify for a temporary upslip.
Correct. There are guidelines for each waiverable condition, different medications. Some may have temporary criteria that you can have an upslip while you're working through the process, and some don't. They're all individual.
Now you mentioned medication just a minute ago. Will you kind of talk a little bit about what aviators should know before starting a new medication?
They should talk to their flight surgeon every time.
Now, if they get referred off base or go to the ER and get a medication, what should they do?
Talk to their flight surgeon.
And that's where you've heard about in one of our recent episodes. That's where Flight Surgeon of the Day comes in.
Right. And that regulation where it says that I must notify my flight surgeon of treatment, AR 40-8, 100-105. I must notify my flight surgeon of any treatment given by a non-flight surgeon.
And just to remind everyone, Flight Surgeon of the Day is Monday, Wednesday, and Friday, 8 to 11.
They can also notify their flight surgeon through that circular messaging.
Patient portal. Patient portal.
Can you explain the difference between temporary restrictions and permanent disqualification?
So a temporary restriction means that you cannot fly. You are downed for a period of time. Now, you are technically downed until you get an upslip. A permanent disqualification means you cannot fly until you get a waiver that says you can get back up. Now, if you have a down slip that says you are temporarily grounded for a week, it is for a week or until you get an upslip. A permanent disqualification, you will not get a new upslip until you have a waiver that grants you to come back up.
Lyster, in particular, has a lot of new aviators that will do initial flight physicals for the first time. I think we see a lot of folks that might be getting guidance that we can only see their records once they join the Army or 18. Can you give a little bit of advice or talk a little bit about what you guys look at and some of the advances in technology?
Yeah, so I think the medical record system has advanced pretty significantly in terms of what we can see. I would say about 10 years ago, we weren't able to see somebody's history prior to their military service. Now we get summaries indicating diagnoses from childhood up until when they join the military. And so from my perspective, when I'm doing an Aeromed psych evaluation, I'm looking for somebody to be truthful in their disclosure of their history. When folks come in and don't disclose significant events, such as a hospitalization for a suicide attempt or suicidal ideations, that really, for me, brings up questions of integrity, which plays into our Aeromedical Adaptability APL.
Okay, so what I'd like to expand on transparency. So what 10 years ago, what you're speaking about is we had a closed medical system. Now we have an electronic health record, and that encompasses about 80% of the worldwide health records. So that means when you were 2 and your mom took you to the emergency room for an ear infection, we have access to that. That means when you were 12 and your parents divorced and you needed to speak to a counselor because you were having problems at school, we have access to that. That means when you were 16 and you tore your meniscus and you had a concussion playing soccer, we have access to that. So when you fill out the 2807-1, which is your report of medical history, it has questions that says, do you now or have you ever? We expect transparency in those questions. And now, we know that we are looking for transparency because when we see this, I'm going to tell you that I also need to give you transparency. So when you answer these questions and then I look through your medical record, I'm probably going to ask, hey, I saw in your record when you were 16, you were on this medication for 2 years. And sometimes I got it. We don't always know. Maybe your parents didn't tell you were taking a medication for something, but I'm going to kind of ask you, hey, do you remember taking a medication every day for this? And we're looking for that. There are going to be conditions that may disqualify you, but that doesn't mean you won't get a waiver for it. The transparency comes in, do you willfully not disclose this, or are we going to have a conversation and work through this together? It's a partnership. And even if you don't think it's something important, like you may think, I had asthma and I grew out of it. We still need to know about it. There are conditions that may not be very important because you kind of gutted through it, but it's something we still need to know about.
I think that's where some of the hang-up results from is that folks are like, well, it's not bothering me anymore. I'm over it, so It's no longer an issue. But we're really looking at the entirety of their life.
No, great. And I think you said it at the beginning of this series is that you always try to find a way to get to yes to keep aviators in the air. But before we wrap up, let's play a little lightning round of fact or fiction.
All right.
Myth or fact? If I report an injury, I'll never fly again.
Myth.
Myth or fact? If I see behavioral health, I'll lose my flight status.
Myth.
Flight surgeons are looking for reasons to ground aviators.
Myth.
Most medical concerns are easier to manage when addressed early.
Fact.
Seeking help is not a sign of weakness.
Fact.
Today, we talked about some of the biggest myths surrounding flight status, medical care, and what happens when an aviator walks into a flight surgeon's office. The reality is that aviation medicine isn't designed to take aviators out of the cockpit. It's designed to keep them healthy, keep them safe, and when necessary, help them return to flight as quickly as possible. The most dangerous words in aviation medicine often aren't, "you're grounded." They're, "I didn't want to say anything." Whether it's nagging injury, trouble sleeping, stress, fatigue, or concerns about your mental health, early conversations almost always lead to better outcomes for you, your crew, and the mission. Remember, your flight surgeon isn't simply the person who signs your physical. They're part of your aviation team, your advocate, and a resource dedicated to keeping Army Aviation ready. Before we close out today, I'd like each of you to answer, if every aviator at Fort Rucker or that is listening to us from other locations can hear one message from you today, what would it be?
Mine would be one word, and it would go back to what Liz was saying is transparency.
I'm going to say transparency too. It's my favorite. So
Slides
I'll
are
take two
my
words:
wardrobe
transparency
things.
and partnership.
Episode 8.
For 7 episodes, we've explored the science, the medicine, the myths, the regulations, and the incredible people behind Army Aviation Medicine. But today, we're ending where every mission truly begins, with trust. A pilot trusting a medical team, a nurse caring for an aviator before, during, and after the mission. 2 professionals with different jobs, one shared purpose, keeping America's Army Aviators in the fight. Welcome to the final episode of our Aviation Medical series. I am joined today by 2 of our very own, our Deputy Commander of Nursing, Lieutenant Colonel Rebecca Mercer.
Hi, thanks for having me.
And our very own company commander and resident medevac pilot, Captain Christian Sprinkle.
Thank you for having me, ma'am.
Thank you both for joining us on our last episode of this aviation miniseries. So let's try fact or fiction. Pilots always know where they're going.
Fact.
Nurses know everything before the doctor does.
Fact.
Coffee should be listed as medical equipment.
Fact.
Everyone always wishes they were flying.
Fact.
Christian, will you tell our listeners about your very first flight?
Wow. Let me reach into the Wayback Machine. My very first flight was just prior to Christmas in 2017. I had my nickel ride in a UH-72. My instructor pilot was a Mr. Paul Madrid, and he took us up to about 3,000 or 4,000 feet in the air. He said, "You have the controls, practice ascending, descending," and that's kind of it. Your first taste is just a very brief adventure before you get to come back and start the hard work of actually learning how to maneuver the aircraft.
Will you talk a little bit about what drew you to Army Aviation?
Yes, ma'am. So my father was a pilot in the Air Force. He flew RF-4 Phantoms. He said that I would make him proud if I joined the Air Force, and like the good son I am, I joined the Army instead.
Up until now, you've spent the bulk of your career with Army Aviation and not Army Medicine. So you have a unique viewpoint from both a pilot point of view and a medical point of view about how important it is for Army Aviators to trust Army Medicine.
Yes, ma'am. It's the foundation of what aviation is built off of.
And then can you explain, in your opinion, why trust between aviators and the medical team is so important?
Yeah, absolutely. So right from the get-go, before you ever set foot in an aircraft, you're going to be poked, prodded, evaluated by a flight physician who's going to assess that you're physically, biologically, I guess, capable of the rigors of flying. And so when you do get the chance to get in that aircraft or behind the controls of a helicopter, is that everything else has been approved and they are ready to assume the task of learning how to fly.
When you think about everything we've covered throughout the series, what do you wish more people understood about the teamwork behind Army Aviation and Army Medicine?
Yeah, having made transition over into the clinical side of things, I would just say that when you're in an active role in an aviation brigade or some other like frontline type units, very easy for you to think critically about what support you are failing to get and not understand everything that goes into that support apparatus that exists behind you. So, why is my flight physical not up? Why do they need me to fill out a PHA? Why do they need me to do all this when I'm capable? I just need the support apparatus to recognize that. And you don't really get to appreciate it before you step behind the curtain and see just the enormous amount of time and effort that has to go into each individual aviator, each individual patient to make those things happen on the other end of it.
So when I think of teamwork behind AMED, Army Medicine, and Army Aviation, as a nurse, let me go ahead and get this out of the way. Any good paratrooper would make sure to say that they were a paratrooper at one point. And so as a paratrooper, I used to jump out of these helicopters, aircrafts, be in a force comm unit, with the Charlie Med and the Roll 2, the teamwork that's needed when you're talking about patient evac, right from those forward-ish units. Also worked in a FRSD too, so that teamwork and communication is really important when you're trying to coordinate evac and having the patients packaged up and ready to go, not having, if you're in a hot zone, a hot area, that bird needs to come in, get out as quick as possible and get your patients out. So you're running to coordinate the timing and not have them sitting there waiting. So that is a lot of teamwork. But I would be remiss if I forgot to mention that I was a paratrooper, and I just used to jump out of UH-60s.
The second most impressive job title that starts with a P.
Okay.
Fort Rucker has a significant amount of medical personnel, not just Lyster. There's 5 other medical units. It's not an accident that aviation is co-located with medicine. And you'll see in a lot of units, whether it's the 82nd Airborne with the paratroopers or in any random deployments, generally speaking, in any talk, you always see the Meadow sitting right next to the aviation battle captain. So we're paired together because it is very important that medicine and aviation are nested together. Becca, will you please tell us a little bit about your experience with Army Aviation and Army Medicine?
Sure, yeah. So I guess it was when I was a brigade nurse for 2nd Brigade, 82nd Airborne. And I was the 2nd Brigade nurse with them. And so the Charlie Med, the Roll 2, going out and doing all the FTXs and the trainings and medevac training. So that was the first experience that I had doing the hot and cold load training with them. So yeah, we learned a lot about, the communication and again, teamwork between the Army nurses and Army Aviation.
That's all excellent. One of the unique things that you guys as Army nurses have that is very unique to your corps for officers is that you actually get the chance to be in the back of a bird treating patients. Can you tell us a little bit about that path and what that looks like?
You have the Joint En Route Critical Care course, which is here at Fort Rucker. And so you need to be a 66 Sierra, an ICU nurse, or a 66 Tango, an ER nurse first, and have experience there. And then you have to go get a flight physical, get all of that done. You can go to the course and learning, how altitude and ventilators and drips, there's so much to it, but that is a really critical position that the Army has, and we're very short and few on. That is something that, and actually right now they have changed it to where you get an identifier. It's a Mike 5 identifier if you actually complete the course and are a position. There's also flight burn nursing too. That's another option.
Those are excellent points, and I know that the en route critical care nurse is relatively new in the grand scheme of Army medicine. I think it came about because of the significant length of patient transfers in Afghanistan with ventilated patients ultimately. Mm-hmm.
Captain Sprinkle, as a pilot, what are your views on having a ECCN in the back of your bird?
Well, thank you for asking. I think it's a dramatic improvement over the care capabilities that we would provide in our current setup, which is a one flight paramedic and one crew chief who has kind of been side trained to identify, here's a bandage, here's how you spike an IV bag. So to have a team of medical professionals in the back providing that care to the patient who are both communicating in a language that they understand, I can't imagine a world where that doesn't result in better outcomes for the patient, which at the end of the day is what we are all about.
Drastically improves those. 2 highly trained medical professionals. Yeah, because you have your ICU or ER nurse that's not just a brand new one, and your flight medics, they're highly trained and know what they're doing, so that's really, really good.
This is a question to both of you, because arguably you both have incredibly stressful jobs at times where every decision you make or lead your teams through, it does have life or death consequences, but how do you stay calm when everyone around you is looking to you for answers?
Everything that you experience, be it in a helicopter, in a operations cell, has been experienced before. So if you do the due diligence of researching, reading, studying, then you can pretty adequately prepare yourself, not necessarily to succeed at every stressful environment or dangerous situation that you get into, but to give yourself the biggest chance at meeting it successfully. In aviation, we've introduced FRC cards, which are the new emergency response methodology, and that drills into you the proper actions to take and referencing a physical card. And so you will react to a situation the way that you prepare for it. So if you prepare for that situation, you will react accordingly.
Yeah, true. That's I'd say like you said, the training, the exposure. As a nurse, I was pretty scared thinking about being an ICU nurse, and there's so much to it, and there is. But going through the course and then all the training, and I mean, really, it just comes down to ABCs, airway, breathing, circulation, like stop the bleed, make sure there's an airway. Once you get those, everything else, and then just knowing who your team is around you and being able to delegate and knowing that hopefully you have been a part of training that team. And so everybody is also prepared for what they're supposed to do, whether it's your respiratory therapist, your medics, your ER providers, the nurses, x-ray, like the more you train together, you're a well-oiled machine and everybody just knows what they're supposed to do. And yeah, you just kind of execute. You just work together as a team.
So this is our 8th episode of our Aviation mini-series podcast. You both have incredibly hard and stressful jobs, and both of your professions, from a readiness standpoint, are incredibly important. We focused a lot on the importance for aviators to stay healthy and get medical care when needed. And Christian, you've been in for about 10 years, 8 to 10 years, correct?
About 10 years, ma'am, yes.
What's one health habit, and I think this is important as well for Army medicine as well, but what's one health habit every aviator should prioritize?
I would say for a health habit, just doing something every day, whether it's cardiovascular or strength resistance training, just overcome that mental hurdle and get your body active doing something will prepare you for sitting in the same spot, a stress response that your body is giving you, and it helps you breathe. And if you can breathe, then you can continue thinking, and if you can continue thinking, then you can continue to make sound decisions under stressful situations. So the key is just not being sedentary. And as you get active and move your body every day, you have to listen to it as well. So if you feel those aches, pains, tweaks, coming on as you get older, then you need to seek out the excellent professional help. Here at Lyster, we have excellent physicians, excellent nurses, excellent physical therapists who are all here to make sure that the soldier, service member, aviator gets back up into the air as soon as possible. So just get rid of that stigma and get the help you need, and you can get those flight hours.
One area you just mentioned, we haven't done a lot on this podcast, but have on previous podcasts talked about physical therapy. And your profession, you guys have one of the heaviest helmets, and the vibration of the aircraft does add additional stress that not everyone is used to. So prevention is a big topic. One of our previous physical therapists worked with some of the USAAMA team and exercise physiologists to develop a spinal resiliency program that is specifically geared towards prevention of injuries for Army Aviators. And that's gotten a lot of traction.
A lot of the exercises that I've found most successful have been taken from the physical therapists here at Rucker to help alleviate or mitigate or prevent those injuries that come from excess helmet weight, vibrations, and things like that.
Becca, nursing is very similar to aviation. You guys work long hours. I know prevention is equally as important for nursing, but can you also talk about what's an additional habit? Or
the one thing that I would say that nurses need to be aware of or to be doing is back protection. The movement of patients, good posture, lifting with your knees. It's a silly thing, but it's not a silly thing. We hear it all the time, but it is so important. 17 years now, and it's all catching up. And I'm sure it was some bad body mechanics of moving patients, moving heavy equipment. I mean, you're moving patients from a gurney to a bed, from a bed to an MRI machine to, the helicopter. So back protection is so important. Core strength is important as well to help protect your spine. So that's the biggest thing I would tell nurses. We hear it all the time, but I promise it is literally the number one thing I would tell all nurses to be aware of and think about from the very beginning.
Thank you. That's excellent. I think throughout this mini-series, we've really talked about the importance of prevention. As we wrap up today, I'm just going to ask you guys for your final thoughts, because what you both do is important. So, Christian, when you look out of the cockpit, what reminds you of why this mission matters?
At the end of the day, what I tell myself whenever I get into that cockpit, whether it's back at the Aviation Brigade, doing a medevac mission, and the priority is a patient, or it's here at Fort Rucker and stepping into the cockpit as an instructor with a student, it is critical that when you get in that cockpit, you are healthy, you are well studied and well rested and ready to execute the mission and respond to whatever comes, because our priority as medevac and medicine is always the patient. And if you are not taking care of yourself, and if you are not prepared yourself, then you are doing the patient a disservice, and you will not execute your mission to your fullest capability. So your priority is always the patient, and you should prepare yourself as if you were going to go out and do that mission every time you fly.
Becca, when you care for a patient during the most difficult moments of their life, what reminds you why Army nursing is important?
I've always said one of the things that I love most about being an Army nurse is our patients. And that's what matters and why we're here, is that the patients, we have the best patients in the world. There are service members who are out there risking their lives doing what they do. The less than 1% of the U.S. population, volunteers to be in the military. And those are the people that we are caring for, as well as their family members who also give them the support, and our veterans. So just knowing who our patients are is what drives me and why I love it.
Thank you both for your answers. And I think that ties in very much why Army Aviation and Army Medicine are stronger together, because what we truly do does conserve the fighting strength. As we wrap up our aviation mini-series, I hope one message has come through loud and clear. Mission readiness isn't built by one person or profession, it's built by teams. Throughout this series, we've explored flight physicals, hearing conservation, mental health, myths, readiness, and today the incredible partnership between Army Aviation and Army Medicine. Whether you're in the cockpit, at the bedside, on the flight line, in the clinic, or supporting operations behind the scene, every role contributes to one shared mission: keeping our soldiers healthy, ready, and able to answer the call. I'd like to thank all of our guests who shared their experience and expertise throughout the series, and a special thank you to our pilot and chief nurse for helping us bring this conversation full circle. Most importantly, thank you to our listeners. We hope you've gained a greater appreciation for the people, the teamwork, and the dedication behind every successful mission. Remember, behind every flight is a team. Behind every mission is a commitment to excellence, and behind every soldier is a network of professionals working together to ensure they are ready when our nation calls. I'm Lieutenant Colonel Leah Steder, and this has been Lyster Health Talks. Thank you for joining us for our aviation mini-series. Until next time, take care of yourselves, take care of each other, and as always, stay healthy, stay ready, fly safe.
And that concludes our special Aviation Medicine mini-series here on Lyster Health Talks. Remember, total force readiness starts with you, and Lyster Army Health Clinic is always here to keep you mission ready. Thanks for listening. Stay healthy, Fort Rucker.